Let's talk a little bit now about changes in proprioception and vestibular function. In terms of proprioception, that if I step on a crack in my 20s, my foot wobbles, that information gets to my brain a little bit more quickly than it does when I'm in my 80s, right? The CNS slows down a little bit. So what are things that we can do to address both of these issues? So balance exercises, anything will work. But a great exercise is Tai Chi. Tai Chi has been shown to be one of the best actually, standalone exercise for balance. So if you only did one thing, Tai Chi is great. I also have people do slow walking. I may have them walk alongside a wall or a dining room table or a kitchen counter because slow walking really challenges the balance. Or I have them do tightrope walking, again, with the same setup that I mentioned by a wall or a counter, so they have a sense of security, so they can really challenge their balance. Just getting out and walking, for those who can do so, is really important. Proper footwear, I'm going to show you some examples in a few minutes. Joint positioning training. What is that really? It's all about body awareness. Can I sense my body and know where my body is in space? Proprioception and kinesthesia is sensing the movement, right? So really helping improve that ability. I'm going to talk about that in a moment. And pacing. There are some people who rush, right? The type A personality person, they rush here, they rush there. We have to get people to do activities a little bit more slowly, to walk a little bit slower, right? To change those habits, if that's a habit putting them at risk, to accommodate the changes. So let's go back to proprioception and kinesthesia. Right, that's a sense that we're born with. We're getting amazing information, right? The receptors for movement and position in space are in our tendons and our joints, right? So when we're moving, our brain knows where we are. Now, most people, right, if you talk about the senses, they'll say, oh yeah, hearing, seeing, tasting, smelling, touching. But most people won't think about proprioception and kinesthesia. And learning to pay attention to that. And my job and my role as a therapist and physical therapist as well is that when we're doing any activity, can I bring their awareness to their body? That's really important. In fact, from my point of view, one of the most important skills, and I define this as a skill for an individual, is helping them to develop a better kinesthetic sense. Because with that kinesthetic sense, if they can sense their body, the position of their body in space, they have ownership. For example, if they're making the bed and they're reaching over the bed, they can go, oh, I'm starting to reach too far. I could sense that. Let me step back. Or I'm reaching too high, too low, right? Whatever the challenge might be, it's a skill that needs to just be developed by learning to pay attention to it. And this is billable. What you can see here is one of the major billing categories that PTs and OTs and probably speech therapists use, but I know definitely PT and OT, neuromuscular reeducation, 97112. So the Medicare definition is you would bill for this if you're working on the person's balance, coordination, kinesthetic sense, posture, proprioception. If you're working on those different abilities to improve function, it's billable. So for me, when I'm talking to a client, I'll use the technical language, but I'll also frame it this way. I call it the Swiss cheese effect. All of us have holes in our awareness, right? My job and my role when I'm working with a client, as we're doing activities or exercises, is to help them to develop this better kinesthetic sense. So with that, we can make some of those holes smaller, maybe eliminate some of those holes. And with that will come ownership in that skill that can carry over when they're walking on a busy street, doing an activity in their home. They can learn to pay attention better. It's one piece of many pieces that come together in this fall prevention program. Shoes, which we talked about. I said we'll come back to them. So when you look at these shoes, these are not designer shoes. These are not attractive shoes. But on the left, we can see those, if I walk into someone's home and they got a slipper with an open back, or they're wearing the shoes right above, those can put the person for a fall, right, put them at risk for a fall. All the shoes to the right, although maybe not beautiful shoes, right, goes around the back of the heel. They support the foot, wraps around the foot nicely so the shoe is secure. You would also want to make sure it's not too tight, not too loose. And something you can tell from the picture is you also want to make sure, ideally, that the sole is not too thick and that it's a non-skid bottom, right? Because some people have thicker soles, so if they're walking on the street, they may not sense that crack as easily if they were wearing a shoe that had a thinner sole, and again, all soles, preferably non-skid. And they may have great shoes because these are really good sneakers, but they've been around for a while. And look at the back, especially of the shoe on the left. If I noticed that, I would talk to the person about wearing other shoes until they replace those shoes, because that pair of shoes right there could put the person at risk. So to address the normal change, musculoskeletal changes, right, sarcopenia for some, right, we lose muscle mass, doing exercise of any kind is valuable. See, to me, it's let the person choose what they want, preferably, so that they'll be more likely to continue to do that exercise. But the key thing is that regardless of the exercise, from my point of view, is I want them to pay attention while they're doing it. How many people play music, watch TV? So they're distracted, which is fine, but in the beginning, I'll ask people, try not to do that. So when you're doing an exercise, you can sense and feel your own body to make sure you're not doing too much, or maybe you could up the challenge a little bit more, that you're not creating pain and discomfort, which might be masked if you're listening to music and moving real quickly or really caught up in a TV program. So in the beginning, to develop that kinesthetic sense, that body awareness in the context of doing your exercises is great, regardless of the exercise. And then they can carry over into everyday activities that they do with that same kind of paying attention, which I've been talking about. So exercise to address strength, flexibility, balance, postural control, right? Those two go together. Bone density, the more we're up and moving, really important for people as we age to maintain that bone health. And the last bullet point I've already talked about, that body awareness. And here's a group of people at a local senior center that I had worked with doing some Tai Chi. Blood pressure can be an issue. Of course, many people could be orthostatic, especially when they've been lying down and then they sit up and get up to go to the bathroom in the middle of the night. So it becomes really important, if that's the case, to really educate the person that when you sit up, wait a moment. If you're dizzy, don't move until that subsides. When you stand, if you're dizzy, wait a moment. But regardless, just wait a moment. Allow your body to adjust to the upright position. Then go to the bathroom, right? We're really changing habits and routines. We also want to make sure the person's getting enough fluid. Too many of us, regardless of age, are dehydrated. Compression stockings might be helpful. Eating small meals, exercise, of course, is great. Minimizing alcohol use or avoiding it. And for those where salt is not a contraindication, perhaps adding a little bit more salt to the diet if it's safe for that person to do so. So for cardiovascular and respiratory, exercise. But on top of that, for this population, we want to make sure they know how to monitor their vitals, right? Educating them so they could know, based upon the information they get from their physician, what's my maximum heart rate, what's my target rate, to review that with them so they know that when they're exercising, they want to keep their, let's say, heart rate within this range, oxygen saturation levels. And for those people where, okay, we'll do exercise, but we also, maybe they have COPD and that's progressive, we want to talk with them about energy conservation, that middle bullet point. Things like pacing, working at a pace that's right, where you don't poop yourself out. Prioritizing the activities for a day so that you do, if you do poop out, it's a hot, humid day, you accomplish the things that are your top priority. And if you don't get some of the other things done, at least you know you did what was the most important thing for you to accomplish that day. We also want people, we maybe talk with them about how to organize their kitchen, for example. So if that person really enjoys cooking, putting the things they need where it's easy to reach. So using the lower shelf of the cupboard, or if they take things from below, put it on the highest shelf down below. So we minimize that bending, we minimize that reaching. Things are easy to get, conserves energy, and perhaps having like a bar stool or a high chair so as they're preparing the meal that they can sit, right? All of these pieces coming together to support people. Sleep hygiene. It was something that personally I did not address much in my career early on, and it's something I'm paying attention to now. And I think the important piece is, like anything, once that person does figure out a routine, to be consistent. So we know that we want to wind things down if possible, lower the stimulation at least a half hour or so before going to bed, trying to make sure that where we sleep hopefully could be dark, quiet, not dealing with TV, things like that, or our smartphones, maybe not looking at them for a little bit before we go to bed, trying not to have large meals before we sleep, caffeine, alcohol, and regular exercise can be a huge factor in helping people.